Hi, I'm Keyan Matinpour, Medical Director of the Eisenhower Dermatology and Mohs Center. So in 2018, melanoma affected 150,000 people in the United States. The number one factor in their treatment is the stage at which it was diagnosed. The pieces of equipment that we're going to talk about today can allow us to find melanoma at the earliest stage possible and just to allow simple excision as the treatment without needing any chemo or any further radiation. So the first piece of equipment is the Visiomed device. It's a digital dermatoscope. Dermatoscope is what dermatologists use almost like a stethoscope. On every single patient, we have a handheld device. It's a magnified lens with a polarized light attached to it, and it allows us to see structures on top of the skin that you can't see with your naked eye. So the Visiomed device is a digital dermatoscope, so it really takes that technology to the next level. It allows us to capture still photos of it, to magnify it, to digitally zoom in and out, to optically zoom in. And it's an awesome device that we would use on every single patient. It would come in the room with us. It comes on a little cow or a computer on wheels. And once we take the photo, it's on a huge screen. We don't need to hold the dermatoscope up to the skin anymore, and we can save it and compare multiple moles on the same individual really rapidly. It's a fabulous device, really the first of its kind for digital dermatoscopes. Another piece of equipment we're looking at is a confocal microscope, specifically the VivaScopes. A confocal microscope is similar to the dermatoscopes, except they use a laser and they go through the skin and they actually give us a digital biopsy of the lesion. So the first piece of equipment we use on every patient routinely, just like a stethoscope. The second piece of equipment we would use for lesions that, even with that first piece of equipment, are a little bit equivocal. We're not sure if we need a biopsy. So instead of doing an invasive procedure like a biopsy, we would use this instrument. This instrument, we place it on the skin, it passes a laser through the skin, the laser scattered, reflected back, and we can make an image of what it is without needing to biopsy them. And the resolution of it is at a cellular level, so it's almost as good as a biopsy. So it could save lots of patients unnecessary biopsies and even help us find the melanoma at the earliest stage possible. The confocal microscope has recently been FDA approved in the last 2 years in the United States. It was used widely across Europe, but since its FDA approval, very few places in the United States have actually had the opportunity to get the machine. The biggest barrier to entry is just its cost. These two pieces of technology aren't available at any of the academic medical centers currently in Southern California. This equipment can help us find melanoma at its earliest stages, which also means we'll find it when it's smaller. And the smaller the melanoma is when we find it, the smaller the defect is, the smaller the reconstruction, and the least amount of disfigurement possible. The $200,000 we need to raise for this life-saving equipment is state-of-the-art, could help prevent patients from unnecessary biopsies, unnecessary surgeries, disfigurement, and we can save their lives. We really appreciate it.